A bill making its way through the state legislature right now aims to change California's mental health diversion program. Now, under current law, judges can opt to send someone awaiting trial to mental health treatment in the community instead of to jail. But the bill's author wants more safeguards in place to ensure dangerous offenders aren't released to reoffend. As ABC 10's Nguyen shows us, the bill is getting pushback from public defenders across the state.
Becca, supporters of Assembly Bill 46 say the most dangerous people are being released into the community after completing these programs and disguising it as treatment. Opponents say this bill will make it harder for people to access resources who really need it, resulting in more jail time.
Mental health diversion programs were being issued to folks that truly shouldn't have received the mental health diversion.
Assemblymember Stephanie Nguyen says her bill, Assembly Bill 46, will close a loophole and provide people who truly need help access to mental health diversion programs. Nguyen's bill doesn't include a list of crimes that would be excluded, but she says the bill would help judges make a more clear decision.
Making sure that there's a clear understanding that if there are individuals that pose a public threat, right, a public safety threat, that the judges have the ability to deny mental health diversion programs.
If passed, the bill would require that anyone with a mental disorder have a diagnosis within 5 years before the alleged offense. Supporting this bill, Sacramento County Sheriff Jim Cooper.
If someone goes out and kills their kid, they can qualify for mental health diversion and then get the record expunged.
Cooper says the program can work for those who need it, but also adds that the qualifications to get into the program are too wide.
We have people that have graduated the program and committed crimes. We had a murder here in Sacramento, a lot of other cases, child abuse, and that's where it's been the most horrific, is with the child abuse cases.
According to the sheriff's office, Jordan Murray is one of those people. In May 2025, Murray was accused of stabbing and killing a man after a judge granted him mental health diversion and released him from custody. The sheriff's office says Murray had 2 prior robbery arrests before the mental health diversion program. The California Public Defenders Association argues this program already works and impacts only a small portion of people in the state.
It's 3.39% statewide of people that are accepted and go into mental health diversion.
Adding that resources are more productive than incarceration.
It's a successful program in that people's recidivism rates after they get treatment for their mental health needs are much lower than if they were to go to jail or to prison for these offenses.
The Sacramento County District Attorney's Office says it got more than 1,800 motions for mental health diversion in 2024. 582 people went into the program. Of those, 210 defendants reoffended. In 2025, the DA's office received more than 1,300 motions for the program, but cases are still pending.
Republican Senator Shannon Grove is also introducing a similar bill that would specify certain crimes and make people not eligible for diversion. And more information on this bill is expected tomorrow. Of course, we will continue to follow this and keep you updated on air and online. Becca.
Jeannie, thanks so much.